So I would say that it's truly an honor for me to follow Terry, your presentation this morning. It's a wonderful reminder that behind every data point is a person, and behind every gap in information, there can be very real consequences. Now, while health information is not available, or when it doesn't move with people, then it's not just inconvenient, it can actually lead to harm. What Greg's story brings into focus is that health data is not abstract, and it is not just about numbers or data or graphs, but it is deeply human, and it is about each one of us and our interaction with the healthcare system. So what I'd like to do today, this morning, is to build on that and to explore how we collectively can ensure that the right information is available at the right time to the right people who needs it, so that we can support better and safer care for all of us. So what I'll do today is I will cover 3 areas. First, I'll talk to the journey of health data, from the creation to transforming it into actionable insight, supporting decision-making to inform better care, and to drive research and innovation. I will then talk about why responsible use of data is critical and how strong governance, common standards can help us achieve that. And thirdly, I also want to talk about how collaboration and technology can further help us to build a stronger, more connected, and more data-driven health system. So let's get started. So maybe let's start on a positive note, and that is the fact that despite the challenges we see in our health system and the disconnected care and the very complex issues that we see every day, the fact remains that health data is one of Canada's most valuable assets. Now, we often speak of our natural resources like oil and potash and forestry, but there's another resource that we don't talk about enough, and it is our health data. Canada, we have some of the strongest and the richest health data in the world. Now, what sets Canada apart is the scale, the completeness, and the quality of our data, enabled by a publicly funded, single-payer model. So what we essentially have is a giant data set of over 42 million Canadians, which is one of the most diverse populations in the world. So essentially, we have a very rich foundation for insight, for innovation, and for better outcomes. And it is really up to us to use this data well so that we can transform care, we can reduce cost, and also position health as a driver for innovation and economic growth for Canada. Now, maybe let's go back to the basics for a few minutes. I think many of us in the room know what a typical data management cycle looks like. We all know that health data is generated as individuals move through the healthcare system, and it begins at the point of care when we interact with our care providers and where data is created, captured, and collected. Then data is typically organized, processed, standardized, hopefully to a common set of standards, and to ensure that the data is accurate and usable. Then the data can be further analyzed to extract meaningful information to drive evidence-based decision-making for care, for system planning, and for policy decisions. Now, the data may be further shared in accordance with policies and legislation to support broader uses where it's fit for purpose, for example, to drive research, discovery, and innovation. Now, in the ideal world, once the data is collected, it should be reused and reused many times. And the data should also be regularly evaluated to ensure that it continue to meet quality standards and support ongoing improvements. Now, at the point when the data is no longer needed, we also need to make sure that data is securely archived and destroyed in line with best practices and legal requirements. And this is probably not a surprise to any of us. Now, oftentimes, when we see disconnected care, and in Greg's example, it is not really, the problem is not that the data doesn't exist. We already talked about Canada has very rich data. It is also typically not about the fact that data is not managed well, because I think many of our organizations know how to manage data. But the trouble at hand, or the issue at hand, is really about the fact that data is siloed. And I think, Terry, you mentioned a lot of that in the morning. Data is siloed and is trapped in individual systems, individual jurisdictions, and individual jurisdictions. And the data is not easily shared or accessed, and oftentimes the data is not in the same does not share the same standard. So essentially, the systems do not speak in the same language. Now, when that happens, then the very rich data that we just talked about just sits, but the information doesn't flow. So today, essentially, we may be very data rich, like what we just talked about, but we might be information poor because the data is not flowing to where it's needed. Too often, important details, health details, get lost between visits, between providers, between systems, leading to avoidable errors and gaps. And this is where we see care being slowed down, insights are lost, and then there's duplication and system strains within our healthcare settings. And collectively, as Canadians, we are paying the price in longer waits, in staff burnout, in inequities to access to care, and most importantly, perhaps, is a missed opportunity for improved care, for research and innovation. Now, we may each have our own stories or anecdotes of missed opportunities as we each encounter our experiences through the healthcare system. And these are just some examples. They're not hypothetical, they're real stories. For example, patient needing to travel across the country, needing care in a different jurisdiction, their history isn't readily available. Now, we know the records exist somewhere in the system, it's just not accessible where the patient is at that moment. Or patients with chronic condition that could have been managed earlier, but wasn't, perhaps because the systems do not allow for easy communication between providers and specialists. Or maybe a family needing to travel great distances just to get a simple thing done or a basic care because the systems in rural or urban centers are not talking to each other. Now, all of these examples shows us that even though the data exists, but if not at the right place, not at the right time to those who need it, then it creates gaps in care and it creates missed opportunities for improving care. So how do we change that? How do we move from a system where data is fragmented to one that is connected and trusted? Well, perhaps it starts with a shift in our mindset. It's in how we think about data, not as isolated pieces and isolated data system, but part of one connected ecosystem. So like I mentioned before, when data is collected once and then shared safely across systems and across settings, it can become so much more powerful. This starts with a one data ecosystem mindset, where clear roles and accountabilities, together with shared and consistent standards, would allow data to be used across care, across operations, and for planning. It also means that we need to consistently improve on quality and timeliness of data so that decisions can be made based on the most accurate and most up-to-date information. And of course, also making sure that our technology and our workflows in the care settings support this so that we can reduce duplication and make data easier to use in practice. And finally, advancing technologies where we can turn the very rich data into meaningful insights in a much more timely way than we do today. Now, when all of these things comes together, then we can start seeing a modernized health data ecosystem, an environment where health data can be used to its full potential. Now, I would say that this health data ecosystem is based on three core pillars. One, having strong health data stewardship, with strong governance where data is shared, used, accessed in a way that is secure, responsible, ethical, and equitable. The second core pillar would be around shared data standards as a foundation, so that the data, wherever it sits, is consistent, is reliably and easily retrieved, so that data can be used together in a second. Third, there's the opportunity to leverage modern technology to improve data flow, to reduce data collection burden in order to free up time for care. Now, to make all of that possible, I think first and foremost, we all know that we need trust in the system. And this is where data stewardship comes in. Now, I think all of us in this room know as well, Canada's health system is complex. And it is not just one health system, it's many different health systems, which is each with their own data, rules, tools, and priorities. Now, my CIHI colleagues have often compared this to Canada's road network. Roads work because they're built on shared standards and clear rules. common designs, signages, and systems for licensing drivers and vehicles so that everyone is accountable. Now, even though rules can vary a little bit from province to province, they're consistent enough for goods and vehicles to be moving smoothly across the country. But healthcare in Canada doesn't work like that yet. The roads exist, but they're fragmented, and then the rules and the standards can vary widely depending on where you are. Different interpretation of privacy requirements, varying levels of trust, unclear accountability, or general sense of risk aversion can really make data moving difficult and making it very difficult to connect and use the data when and where it's needed. So a health data stewardship approach is to tackle these issues at the human, policy, and organizational level. So addressing the human, policy, and organizational barriers behind this challenge. The goal is to make sharing and access to data easier, and we can do this safely and responsibly, ensuring the adherence to ethical, legal standards and indigenous data sovereignty principles, and also doing so in a way that maintains public trust, being transparent about each of our accountabilities. Now, you might be familiar with Canada's Health Data Stewardship Framework. This framework was recently endorsed by the Conference of Deputy Ministers of Health, and it comprised of 7 components that sit along a continuum from strategic stewardship, so think about guiding principles and culture and legislation and regulation, and moving all the way to day-to-day, very technical operational stewardship, such as data management and data use. Now, underlying these components are First Nation, Inuit, and Métis data governance and sovereignty, and public trust and engagement that, of course, must be embedded across every aspect of stewardship. Now, one thing to highlight is that these components are not independent of each other. Progress in one area would depend on progress in others. For example, strong data management without data governance or public trust still would not enable meaningful data sharing. So alongside this framework, there is also an implementation toolkit, which is a set of tools and resources to help put the framework into action. And it's designed for anyone who works with health data across roles and across care settings. It also links to a broader pan-Canadian resource inventory of leading practices. And the goal is, as the dialogue and conversation around the data stewardship framework evolves, that these implementation toolkit and resources will continue to evolve as well as new tools and new guidances are developed. So the Health Data Stewardship Framework provides a structure and a tooling that would allow for safe, responsible, and effective use of health data, but it doesn't stand alone. There is broader sets of complementary frameworks that are foundational to the components that we just described. Now, this slide shows how if the Health Data Stewardship Framework serves as the foundation, then we really rely on our many other partners who have existing frameworks that would guide and complement the components that are identified. Perhaps to highlight a few here, when we talk about data standardization, certainly the Pan-Canadian Data Content Framework that I'll address, it's under development by CIHI, must work hand in hand with the data exchange standards that our partner Canada Health Infoway is developing under CA Core Plus. Or referencing what Terry just described around network health, the health data-related harm framework would help us really think about and describe the impact of what human and financial harm may arise from poor health data use or poor health data design and use. Or the Pan-Canadian AI for Health guiding principles, which were developed by the Government of Canada, highlights that trust is a key enabler for AI adoption in the context of health, and it provides the principles for us as it guides our design and thinking around adopting AI and technologies within the healthcare setting. Now, so these frameworks and tools are there, of course, to give us the structure and for us to think about data stewardship overall. But they don't necessarily help us in making the decisions about how we use the data. So this is where health data ethics framework also comes in. I'd like to spend a couple of minutes on that. Now, at its core, health data ethics is about guiding how we use data in ways that are responsible, trustworthy, and beneficial. It means collecting and working with data in ways that don't exclude or harm people. It also means moving from asking, can we use this data, to asking the question, should we, and how should we use the data? Now, one important aspect when thinking about data ethics is around bias, the fact that bias can be introduced in any point of the data journey. For example, at the data collection level or the data collection point, as we interact with our care providers, how the questions are phrased, or what kind of assumptions the care provider is making while asking those questions, and what kind of interpretations we have as patients when responding to those questions, can all impact how the data is collected and recorded. Now, on the research and analytics side, what kinds of data is available, or what kind of analytical decisions that the researcher decide to make? For example, what data to include or what data to exclude in their analytical methods can also inadvertently introduce bias as well. So for example, we're taking a very simple scenario. If we're talking about data about a certain population, if the data of that population is not collected consistently, or if patients aren't given a safe and respectful way to self-identify, then certain groups may be underrepresented or misclassified in the data. And that means that when we later analyze the data, we may miss very important differences in health outcomes or access to care. And as a result, the decisions that are made based on that data may not fully reflect the need of those communities, potentially reinforcing existing inequities rather than addressing them. So to help guide us in all of that and in the decision-making about data and using of data, the health data ethics framework essentially ground ourselves in a few key ideas. First, around public benefit, that health data should be used to improve care, to strengthen the health system, and ultimately to benefit people. If we're not creating value using that data, then we should question why we're using that data at all. Second is there must be a healthy respect for individuals, reminding ourselves that behind every data point is a person. That means protecting privacy, respecting dignity, and recognizing that people have expectations about how their data is used or should be used. Third is around equity and fairness. Data should work for everyone, not just for some groups, and that means being aware of bias that we just spoke of. Fourth, transparency and accountability. People need to understand how their data is being used, and organizations need to be accountable for those decisions. This is how trust is built and maintained. And finally, protection from harm, and we talked a lot about that. It is not harm just in terms of privacy breaches, but harm when data is incomplete, is biased, or when it's not used when it should be. So the key idea here is that ethics, data ethics, and ethical considerations ensures that data use creates trust and not risk, because ultimately, without trust, we cannot fully realize the value of health data. Now, shifting gears, if we have strong governance and trust in place, then the next step is around connecting, is around connection of data. Now, as we have heard from Terry, too often important health details get lost between visits, between providers, and between systems, leading to avoidable errors and gaps. So really, what is truly connected care? Connected care is about ensuring the health information moves with people. They move with people across providers, across settings, across systems, and across the country. So what does connected care really look like in practice? Well, when systems can actually talk to each other and data can move seamlessly across systems, then clinicians can see a patient's full history with no delays and no repeated paperwork. And when this happens, then we can start to see real benefits in the system, in improved patient safety, when the decisions that clinicians have to make are based on complete information about the patient in front of them. There's improved clinical decision-making because providers now have broader context about the individual that they're providing care to. It also helps advance health equity with information being available more consistently across systems for all groups. And ultimately, it also supports population and public health because it allows us to look at the data in a broad sense and be able to help to get a view into patterns and trends at a much faster and more clearly. But to do this, we need to have a very strong foundation in data standards, because foundation in data standards is what truly allows data to move seamlessly across systems. Now, the Pan-Canadian Health Data Content Framework that is under development right now, and it's evolving, is a single comprehensive standard for health data across Canada. It defines how data should be structured and organized so that it can be understood and used consistently and compared appropriately as it's shared across systems. Now, the key to this data content framework is that it is co-designed with people and partners, with our care providers, with digital health partners, with First Nation, Inuit, and Métis communities, and all levels of governments. Now, building on the data content framework is the Canadian Core Data for Interoperability, or the CACDI, which essentially defines the minimum subset of data that is absolutely needed to support patient care, so ensuring the key information can be shared across systems and jurisdictions. Now, both the framework and the CACDI is designed to evolve over time and expand incrementally through a transparent, collaborative co-design process. Now, beyond data content standards like the CACDI, there are other complementary standards, such as code systems, exchange standards, like I just mentioned around the CA Core Plus under Canada Health Infoway, to ensure that data is structured consistently and can move seamlessly across the system. But underpinning all of this is also strong privacy and security standards so that we can ensure that the data are protected and secured at all times. Now, at this point, I also want to highlight Bill S5, which Terry had also mentioned, is the Connected Care for Canadians Act that was recently tabled in the Senate. Now, as Terry described, the bill looks at establishing and requiring the adoption of common health information technical and data standards for interoperability, and that it ensures that health IT vendors must follow and prohibit data blocking. Now, we know that we mentioned this morning, regulations are still being drafted, and it would set out the specific requirements around standards and around enforcements. But nonetheless, this is very encouraging, and is certainly a critical step in moving us towards a more connected health system in Canada. Now, I think at this point, I'd like to address that if we have strong governance in place, we have shared standards, then we also need collaboration and partnerships to turn the wealth of data into value and meaning. There's no one organization who can do this, but together we can coordinate across jurisdictions and sectors, and also leveraging technologies that can help us turn this data into insight in a much more timely way. Now, when we talk about collaboration, I must mention CIHI, which is one of the great examples of pan-Canadian collaboration, as we host and manage and provide access to trusted, linkable, and comparable data that spans the healthcare continuum. And we've been doing this for over 30 years. Now, we've been able to do so based on strong partnerships across jurisdiction over the years, with legislations in place or very clear and concrete data sharing agreements that clearly states around CIHI's role in stewarding their health data. But certainly, this partnership is beyond just a jurisdiction and with Health Canada. There's also other data partners within the health data ecosystem that does the same thing, and we're all working towards the same goal. And together, we'll also continuously engage with patients, people with lived experience, families, and communities to ensure that they're at the core of decision-making about the sharing and use of data. Now, with rich, connected, and also well-governed data, it presents us with the great opportunities then to use technology to further unlock the value of that data. And we're collectively looking at the possibilities of technology that can help us modernize and streamline workflows in care settings, reduce manual efforts, and in managing complexity as the data volume grows and the expectations for timeliness increase. Also, at points of data collection, ingestion, transformation, standardization, and processing, there's great opportunities for AI to help extract, classify, and pre-process data from different sources and formats. There's also automation and other capabilities around real-time validation and quality checks that would help us identify inconsistencies and anomalies in data earlier so that we can improve data quality in a much more real-time way. And ultimately, we're looking at the possibilities of more automated, more analytics-ready outputs, enabling faster insight and more scalable, intelligent data infrastructure. Now, we're also seeing the potential of AI in areas like clinical coding. These tools, for example, are concrete examples of how we can support more accurate documentation, improve data quality, and reduce administrative burden on our providers so that they can free up their time for what matters most, which is patient care. So, at this point, I'd like to circle back to the beginning of my presentation. So a reminder that Canada has a unique asset in our rich, comprehensive, and trusted health data. And when used responsibly, this data can improve care, can support our workforce, and also accelerate research, discovery, and innovation. Now, additional return on using our data better is also to protect our very cherished public healthcare system, which is under threats of rising costs. We know now Canada spends over $400 billion a year in health, and it's going to grow at 4% annually. We cannot outspend, and we must out-innovate in order to drive improvements in our health system. And strong, good, well-governed data is at the core of that. Together, we can drive more timely, equitable, and effective use of health data to bring faster, smarter, and more informed decisions, so that together we can bring about a stronger and more sustainable healthcare system. And this is a great opportunity for all of us to work together and advance that vision.